Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, now you have what is the algorithm? Now the question is algorithm of upper GI bleeding. So what is the algorithm of upper GI bleeding? So for example, if the patient comes to you with bleeding and if the patient comes with bleeding, you have done an urgent esophagogastroduodenoscopy, which is nothing but endoscopy. So this is done and you have found out that it is forest 1A. There is bleeding and according to the forest classification, it belongs to either 1A or 1B, 2A or 2B. Okay, you have found out that it belongs to 1A, 1B, 2A, 2B. If yes, then you should do an endoscopic therapy should be done to the patient. You have done an endoscopic therapy. Okay, next, if it is no, there is no bleeding at all. Okay, in such cases you will have to assess for H pylori infection and you should treat the patient with proton pump inhibitor and do an endoscopy repeat for gastric ulcer. You should do repeat endoscopy for gastric ulcer if there is any. Okay, this is one thing. Then after doing endoscopic therapy, if there is bleeding is seen, then you do an endoscopic therapy. Now you have done an endoscopic therapy. Okay, now you have done an endoscopic therapy and after endoscopic treatment you have found out that there is continuous bleeding is seen even after endoscopic treatment. If it is yes, then you should do surgery. Okay, but if there is no continuous bleeding, that is the bleeding is decreased, in such cases you can monitor the patient. If there is any re-bleeding, okay, if there is any re-bleeding, then you will have to again do a repeat endoscopy. Okay, and you will have to try to control the bleeding. But even after repeat endoscopy, if even after repeat endoscopy, if it is bleeding again, okay, if it is continuously bleeding again, if it is yes, then you should undergo surgery. If there is no bleeding, then you can monitor the patient. But even if it is third time, if there is re-bleeding, first time there is bleeding, you have controlled it but it did not control, or you will do surgery. But if it had controlled and then you are monitoring and there is bleeding again and then you do repeat endoscopy, it is controlled again, you are monitoring it again, there is re-bleeding, that is the bleeding is present for third time, then you should do a surgery. Okay, so this is the algorithm for treatment of upper GI bleeding.
thank you and thank you for watching.